And talking about our topic today. I'll be speaking about autism spectrum disorder and anxiety throughout the lifespan. And so I know we at LOA, we do, of course, receive a lot of referrals for clients who are struggling with anxiety. And sometimes we're noticing other symptoms present, whether they are kids, teens, adults, parents that we're working with. We're noticing some of these other neurodivergent traits. So I like to talk a little bit about how that affects the work that we do here. All right, so the first thing I like to explain to you, because I know obviously everyone can read about what is autism spectrum disorder in the DSM-5, but I like to also just define what we're looking at here and also highlight a lot of the strengths that people who do have a diagnosis of autism spectrum disorder or are on the spectrum do tend to experience, because as I'll be talking a lot about in this presentation, we're going to be focusing on being neurodivergent affirming rather than trying to fix or like change anyone's way their brain works, because that is not possible anyway. So when I'm thinking about what is autism versus things like ADHD or any other neurodevelopmental disorder, this is really about social interaction. So how the person perceives their social world, struggling with so this can be a couple of different things. So like maybe misunderstanding and misinterpreting or not understanding social cues, or not even really being aware of social cues or emotional cues in others, difficulty understanding other people's perspectives. And so that theory of mind of like, okay, like I know how I feel in the situation, but I don't really get how you're feeling. You're a whole separate being away from you and away opposite of me. And so that can cause a lot of difficulties with communication, right? Because if we think about someone who is like focused on, okay, I don't really get what people are thinking and feeling. I don't really get these things. So how am I supposed to talk to them and communicate with them and understand what's going on in this situation? And then, so of course, there's difficulties with social interactions and communication. And then we go into a little bit about more of that repetitive behaviors and restricted interest. And so this part is more about how it's all about more of that self-soothing sort of thing. So for example, the restricted interest is focused on, okay, this is my special interest, is something I really love. I'm going to put all my like effort and thought into that, and that feels good for me. That feels self-soothing for me. And then the same for repetitive behaviors, we call them stimming. So for example, that's like, and you might not see this similar in adults. So for kids and teens, it may be more like out overt, where it's like, okay, I can see them hand flapping. For younger kids, if they're more on a different like level, but like for some more high functioning adults and teens, you may see like just like things that may not be too overtly visible, right? So again, a lot of this, like in some young kids that come here, I know like, okay, I can see like this is very visible, but for some people it's really not. So that's why it's a spectrum. It goes from level 1 to level 3. So like, a lot of people we're going to get here are probably going to be more on the side where they are functioning really well, but experiencing a lot of that anxiety. So I'll talk about that. Anyway, so repetitive behaviors can be really anything that's done repeatedly, but we know the cause is just to be like, okay, I'm needing to calm myself down and I'm overwhelmed, I'm overstimulated, for example. There's often always difficulties with sensory sensitivities, and so, for example, the very common ones that I've seen are like the loud noises, needing sort of, textures, foods. A lot of kids and teens and adults struggle with eating because of that. And so those are just some examples. Smells, so a lot of these are going to be more, I tend to see more sensitive, so more overstimulating. And then a big one is just that difficulty with being flexible. So as we know, if there's a lot of like kids who struggle with changes in routine. And so as you can see already from my explanation, some of this can be connected to anxiety anyway. A lot of kids who experience like difficulties with routine and changes, like parents are talking to us about it, and doesn't necessarily mean it's autism as well, because kids who struggle with change tend to have trouble adjusting, may just experience anxiety, frustration, maybe something else. So just a note for that. But if we take all of these together, then we're seeing sort of a brain pattern. And that's what we're looking at here, sort of a brain pattern. And there are, and I don't know the details on this, is kind of interesting, but there are structural and functional differences in the brain for those who are diagnosed with autism spectrum disorders that's why these, but it has to be this full pattern here that we're seeing. And so I wanted to highlight strengths that are really important because there are quite a few. So a lot of, and again, this is not everybody, just the same as like, you know, if someone's on the spectrum, it's not like we're going to see all these things, just like the same as in any culture, we won't see everyone have the same strengths or, you know, that kind of thing. But, you know, based off of some of these, what I've seen too, a lot of these kids and teens and adults like really have this strong memory. Like they are really very, their intellectual functioning is really high and good. So they're like, they can be gifted in certain areas, right? So maybe it's their memory, maybe it's some of their executive functioning, their ability to plan ahead. Maybe it's not that, but it's like their ability to remember everything about like their specific interest. So there's a lot of things that we can see that are very, you know, as like if we're neurotypical, like that might be harder for us. And so it is such a strength that they have. Attention to detail is one that tends to happen where, you know, where like there's so much information out in the world and they're focused on a very more specific detail rather than the full picture. Again, we can see that could be either good or challenging depending on the situation, but that could be helpful in many contexts. And in some, you know, some jobs, I would say like that is going to be super helpful, like computer science or like some areas where it's like, okay, we really need to focus on like these little details, then that's so great. And then, you know, I've seen creativity too, of course, like the imagination and that kind of thing too, you know, some people can be pretty creative. You know, with this, it comes a sense of like, okay, I don't understand like the social norms. Like, for example, okay, why do people always have to say this certain thing when I'm speaking, or like the small talk and that kind of thing? Like, it doesn't make sense to me, so why would I do that? So so a lot of people are gonna just probably be more blunt or honest, or like just say how they feel, but that can be refreshing also in some ways, because in our society we're so like indirect and we may not always say how we feel. And so again, there's the flip side. So I realize I do not have a resource page, and I do have resources for you guys on like psychoeducation and kind of even these strengths for kids and things like that. So I'm going to send that to you, and I'll send that to you next week. A strong sense of justice is pretty big. You know, like if something's unfair, it's like, okay, that's wrong. And, you know, that's so good also, I think, for people to be aware of and notice. And a lot of people on the spectrum can be really loyal and dedicated when they do connect with someone. I think this one's really great as well, just because like I know connection and communication is tough, but it doesn't mean they cannot like experience wonderful friendships and relationships. And that doesn't mean that at all. Like they are can be very dedicated and loyal, and you know, I think that's a very good one. Routine. So like if there is a routine and they can be very structured, and then if they have a goal, they can be like, okay, I'm going to go ahead and like, these are the steps I'm going to take. I'm going to follow through and take it. As you can see, some of this are a little bit different from ADHD, where they may not. ADHD can strive with routine too, but I think they struggle more with the follow through in you know, the different habits because of their difficulties with executive functioning, passionate interest. That kind of goes with some of what I've been discussing, and the analytical abilities as well. So I think I said, you know, what we're looking at here is just kind of the brain's tendency to prioritize logic over social emotional concerns. And so, you know, sometimes we call this twice exceptional, but the sense of like there's giftedness in one area of the brain, but they're not able to kind of understand and, you know, engage in the social world as well. So let's talk a little bit about how anxiety plays a role here. And so now that we know a lot about what autism is, it makes sense why our clients who have this diagnosis feel more anxious, just because the social world is very confusing and unpredictable and is very, very nuanced. And so, like, for example, if I go to class and there's a math problem and I'm like, okay, I can do this math problem and I get this right. But if we're in a social situation, it's really very opposite of that step by step. Like if I say this, the person could be react completely. We don't know what, like, it's unpredictable. We don't know what the reaction will be. And so, because all of us are very different. And so I just wrote a little bit, and you can kind of read a little bit of some examples of why, anxiety can be more prominent, just because, why are people not really following the rules? Like, it doesn't make sense. Like, so many things just don't make sense. Sensory issues are difficult to handle in the social situations, not understanding nonverbal cues, not understanding why people might say they got hurt from something that was said, not understanding people's reactions. I know that one example for me is a child that I see in therapy, and she often asks me some questions like, why did you say that? I don't understand why, and for me, when I'm saying these things, it doesn't register to me that it would be something that someone would be confused about, right? But for her, she's not seeing where that came from. And then eye contact as well, which we know that that's kind of a stereotype too, in the sense of, like, a lot of kids with autism struggle with eye contact, but eye contact can be really, like, confusing and overstimulating too. So if people feel like they're being stared at, I'm sure that can feel a little frightening. So again, with this, and also if everything is changing and we can't predict anything, of course we're going to be anxious about it. If we need routine, if we need things to be a certain way, then and it's never, like, unfortunately, our lives are never really like that. And so that intolerance for uncertainty, need for sameness, and then of course, we can soothe ourselves, we can, manage this discomfort, but, like, that is also because there's always going to be change in the world. So I think that's why it can be really hard. And it's not like a type of change that, okay, I'm just going to adjust and get used to. So, like, that's if someone just has anxiety and is like, I'm going to go to college and get used to this big change, and then they're, like, adjusting to it. So it's different from that, just because of the way their brain works. So, okay, so I just wanted to shift a little gears on, like, when we talk about referring parents for a neuropsych evaluation, because I know everybody talks about this in the sense of referring parents for ADHD assessment or autism assessment. I've noticed also that a lot of parents come in and are like, okay, I think my kid has ADHD. ADHD is definitely one of the big hot topics right now, I think. But also, I think that it's really good to see if there may be some of these symptoms going on as well when you are looking at anything neurodevelopmental, just because that might be missed. So, for example, I wanted to also mention that I've noticed that if someone does a neuropsychological evaluation, well, okay, so this is not so here, we do really great comprehensive evaluations, but they go somewhere else. If they just say, okay, I think my child has ADHD, they might not assess for autism, even if there are symptoms present, because they're just focused on that specific referral question. Okay, so when we talk about referring parents for a neuropsych evaluation here or elsewhere, we really want to talk about, like, okay, this is not about, like, labeling or shaming or anything. So it's great to always talk about strengths first. Things that you're seeing that you're like, oh yeah, this child is doing such a great job. Like, I'm noticing that they are really strong in these certain areas, and they're really great. They're a joy to talk to. I find them really interesting. Just starting with some of these positives can be super helpful. One thing that I've done is take my time in doing this. So, like, for example, if I have a client that I am curious about, I am going to take some time with gathering evidence throughout the sessions, just because I wouldn't want to just immediately say, oh, I think this is going on. I would want to just make sure that I did my own sort of mini assessing first. And so what that might look like, I did this for a recent client. So what that might look like would be just the assessments that we have to rule out, okay, is there significant anxiety, depression, maybe attention problems, things like that from the questionnaires that we do have. And then if you're noticing some of these brain pattern that we discussed today, like if you're noticing quite a bit of those, I usually ask questions to parents, what they see at home, and then I ask the kid as well what their perspective is. And then from there, I'm not going to give the diagnosis myself, but I might say, like, in order to understand your child better and how their brain works, I recommend a neuropsychological evaluation that will help us see what's going on. Yes, Lisa.
Can you give us some examples of questions that you like, actual things that you would say to the parents, like in your tone, or if you did something? Yeah, just some examples of ways that you would word it.
Like the questions I might ask about the symptoms, or
yes.
Okay, so when I talk,
like off the top, yeah.
So
I'm curious in this moment what that would look like.
And I know I worded differently for like the parents and the kids, and so like for the parents, I might ask more like when you're noticing change in routine, I guess I might consider like, okay, when they throughout their day, how often do they struggle with change or something like that? So I'm like getting just more information about, because I know that they struggle with change, but then I'm asking like, okay, like maybe the who, what, when, where, why kind of questions, like, okay, like often does this happen? What are the biggest triggers is a big one, like for meltdowns. Because I know a lot of parents come to me about like, okay, my kid is having a meltdown, and I'm like, okay, let's kind of figure out like what are the main triggers for that meltdown. And so if I'm seeing patterns in those triggers, like, okay, change, sensory issues, maybe the reaction is like having to do repetitive behavior, or like so I'm seeing like a pattern like that, then like, okay, maybe there is something else going on like that we need to refer more for. And then I guess you can take each of the like sections that we are discussed and then ask a question about that, like to see if you can rule it out. So for example, like if they say no to everything, it might not be really something you would want to refer for at all. Like, oh yeah, no, they are fine with sounds and smells, and like I don't see any sensory issues, I don't see any repetitive behaviors. And then that is actually a really important part of the criteria. So then you'd be like, okay, maybe that isn't really at this time. So I think just like you can do your sort of like, you're not necessarily diagnosing, but there was one time recently where I think when I did that, I was like, it was not clear at all. Like I wasn't able to be clear. And so I was like, well, that's when an evaluation is really important, because we're really trying to get at the root of what's going on. And honestly, like if the parent's confused and they're like, I don't get what's happening, and when I'm communicating with them, like they're not understanding me and I'm not understanding them, then we're seeing, and then you're seeing these clear symptoms. And I think it could be, I always tell parents that this is about like understanding the child, and like, how can you help support your child, and what can you do? There'll be a lot of recommendations as well. So I hope that's a couple of helpful things there. So when I'm talking about this, I kind of mentioned like this evaluation gave a clear picture of what your child needs for treatment, because they're in treatment with me or with any of us. But then we can go off and help with the symptoms. But if we know a deeper neurodevelopmental disorder, if we know that there's autism going on, then for example, we might change up a little bit the treatment plan. We might do something a little bit different, or just that like even just that understanding, like this could be potential autism, helps us as therapists, because then we would approach it a little differently, which I will explain. And then just knowing what services and accommodations, and also like I think if parents understand like, okay, my child's brain is wired a little differently, like I will actually have to be doing something a little bit different to communicate with them and to interact with them. That's very powerful, I think, just because I think there's always these expectations, like my child needs to be developmentally hitting all these milestones. And the problem with that, though, is that if a child is not neurotypical, they're not going to be really doing that so easily. And so like the parents' expectations are probably always going to be like, they're always going to be that disappointment of like, oh, they didn't, do that. And so I think, thinking about when we assess for these kids, they're often maybe not necessarily appear developmentally younger, but they may have certain areas in which they're not growing so quickly because they struggle a little bit more. And that's all okay. And just like, I think just helping parents like get more empathy for those is how I see it. Because then that could reduce that frustration for both the child and the family. And so the thing with autism though is like, it does look different in everyone. And so it's not always clear cut. And then some, especially if they're teens, they might mask their symptoms a lot, and even some kids might. And so a diagnosis can be hard, sometimes missed in females versus males, for example. And so just things to note while you're, seeing this in this area. And again, like I told the parents too, I was saying that, whether there's a diagnosis or not, like this is more about like understanding your child. This isn't like, okay, we need to like, this isn't like, okay, we need a diagnosis or anything. And so I think that like, even if there isn't one, it could still be helpful, right? So I think I like to go into that of why, like, okay, if you don't receive one, if you receive a diagnosis, what might happen? But if you don't, then how can the recommendation still be helpful? So I think I go into all of that too. And I also make it a very collaborative process, because even if I'm saying like, okay, I recommend, I'm not saying, okay, this is something that you have to do or has to be done. It is your decision. So I'm always very collaborative with parents also, but I feel like it is our job to kind of like recommend what we think is going to be most helpful for the child. Okay, so just a few quick things on this, because autism and OCD tend to be very correlated. So I kind of liked this little cheat sheet here. So when we think about repetitive behaviors, it can look like compulsions. So in OCD, the compulsions definitely, the purpose is different. So the purpose for OCD is to reduce that distress and anxiety because of all those intrusive thoughts. And so with the white box and the CY box, we have the list of like what kind of intrusive thoughts that people might have and compulsions that they might have. But for autism, these repetitive behaviors are not about that. They're, they really are more soothing. So like for compulsions, we want to like reduce them. But for that's why it's so important to know the difference. So, but for autism, we don't want to get rid of them. We want to figure out ways to like actually help them keep them, but in ways that are maybe appropriate in the social context, or like if maybe something is like helpful or not helpful for them. So I think, yeah, Michelle, I think it is.
Hi, I was just wondering, have you had a child who has a diagnosis with both autism and OCD? And if so, what does treatment look like? Because how do you differentiate the purpose and what's a stim versus a compulsion?
I don't think that, I'm trying to think, I don't think I have had that, but I'm trying to think of maybe another therapist might have, because I'm trying to think about that. But I do understand your question overall. Like, for example, I would say that just that awareness is really important. Lisa?
I'm so sorry. I do have something. Keep going. I
Oh,
didn't
okay.
mean to cut you off. I thought you were,
Yeah.
yes. I have an example of this.
Oh, that's so good. Okay.
Yeah.
So I think for me, it's more about like that awareness of, okay, you can ask questions about it to the child and the parent too, to kind of get that awareness of like, okay, like when they do this repetitive behavior, like where do you think that's coming from? Because what we're looking at is like the core fear. If there's a core fear about it, like for example, I am working with someone that has more emetophobia and autism, and that emetophobia is like, that's like more like anxiety based. So exposures could work with that, but then I have to be careful with like the sensory sensitivity, right? So like I think it's just we want to just be more careful when we're doing exposures, I think, and just understanding what could be triggered and what else could be triggered because of the autism. Does that feel a little bit? Yeah, because like I think with OCD too, it's like, okay, maybe I have like intrusive thoughts, and then I do something like to reduce that distress, but like it doesn't, I feel like once you talk to the child and the parent a little more, I think that it will get more, I think, clear, if that makes sense. It just, sometimes it takes time, and that's okay. Like you can take your time with that.
And if we really weren't sure, would this be a good instance too of doing maybe like a clarification diagnosis appointment if we really were struggling to figure out? And I know you had some examples or somebody who had something.
Yeah, it might be one where you might seek supervision or get consult a little bit on. I think that like if it's just kind of this one symptom concern, that might just be something to kind of ask and tease out a little bit with a supervisor.
Thank you.
Yeah. Let's see. So I wanted to say, Yeah, because OCD is all about core fears. Like there's something that's going to happen, but with autism, it's just like that specific routine, like that specific change. And that's very different. And then OCD is usually they're aware and distressed by their thoughts and rituals. And with autism, they're not, they might not view their behavior as a problem, which that's very common. You know, even if I talk to my child of like, okay, do you notice you have trouble with social skills? They'd be like, no, I'm fine, I'm good. You know, like they're not, that awareness is not always there. And sometimes developmentally depends on if they're 7 versus they're 14. They might be more aware if they're older. And that's helpful. But yeah, this is kind of an interesting way to think about it. Okay, so
Thank you.
yeah, so I'm gonna kind of like just show you guys this and then skip it because I want to go on to a couple of other things. But yeah, so like a lot of these are just the therapies that are out there for autism spectrum disorder. So I mean, individual therapy is what we do, but there's of course like parent coaching, there's social skills training, there's the social skills training group is interesting because they use this is social thinking curriculum, and it is a curriculum designed for neurodivergent individuals. And so I can provide that resource. And then of course medication, but medication would be more for the symptoms like anxiety, that depression, that kind of thing. Not, yeah. And then ABA has been more of a contested one where it's like, for some more severe autism, that may be what they do need just because they're not able to actually function day to day. But it feels like more, it's just like that, like using positive reinforcement for certain behaviors. But I think the issue is that it may feel like, okay, we're trying to make someone neurotypical. But I think for the really severe level autism, the problem is that they struggle with this aggressive behavior and they're not able to be aware of their surroundings. And so that's, I think, that's one thing. And so this other one is like the opposite, the DIR one. And that one's interesting because that's very child-centered, relationship-based, and they using play. I've actually done both of these, and I think it's interesting. But yeah, so that one's very cool, and I've had you know some experiences with that one, but I think it's more like child-led and more like autonomy. Like I think that, but you also work through communication. You teach them communication skills through the experience of being with you. So that's interesting. And I think it just depends on the severity level. Of course, a lot of these kids are in OT or PT for sensory integration difficulties, and I think that one's really helpful. And then speech therapy if they're having speech concerns. So I just wanted to quickly kind of mention some of these that are out there. When we're recommending, we want to be careful of like, okay, if we're recommending something, like why are we recommending it? What's the purpose? That kind of thing. Okay, so I just got this from a different place, but it's just like, what does it mean to be neurodiverse affirming? What I take to be neurodiverse affirming is very like client-led in the sense of like, we're respecting their decisions and their autonomy and what goals are they, their goals and what they're working on. We don't force, respecting all different kinds of communication styles. We're focused on strengths instead of saying like, okay, you have to be part of the social norms or the mold, or like, be part of this. Like, it's like, okay, it's okay to be different. That's unique perspectives are good. We're like celebrating that. And then we are looking at the context of everything too, instead of just jumping straight to like maybe assumptions and that kind of thing. And we are not like putting our own labels onto them. So that's a couple of things. Yes.
I just have a question about when you have a like neurodiverse, especially like with ASD children,
Mm-hmm.
children with ASD, and you have parents that have specific goals for them, but the kids have very different goals for themselves or no goals at all. And trying to respect that. I mentioned a client that I had last week, a couple weeks ago, that he's 14 and he has ASD and his mom is dying of cancer right now. And his dad has very different goals, different things that for us to be working on than he does. So it's quite challenging.
It is. Mm-hmm.
We try to compromise and do a little bit of both,
Mm-hmm.
but
yeah. at that age too, it's teenager, like, so I feel like whether it's ASD or not, I tend to have a certain way I approach those situations. I'm very focused on it being collaborative in the sense of like the team needs to be on board, otherwise they're not going to be able to engage in the sessions and grow. And so I think that I think like what you were saying, I respect the parents' views, and I really will I will bring it in a session if I feel like it's appropriate. But I also tell the teens, like, okay, like, you know I want to make it transparent. Like, I want to make what we're doing transparent without breaking confidentiality, if that makes sense. So this is an example. So like I might say, like, okay, I get, like, with the parents might be like, okay, like, if that's something you want to work on, I'll discuss it with the teen, and then we'll see if that's something that they want to work on, and then we will like discuss next steps after that. So like in that way, like, I'm still like bringing it up, but I'm still giving autonomy to the teen, and I tell them, like, okay, like, you tell me what you, and I do this actually whether they have ASD or not, but like I do this anyway. And so I just say, and then what the teen tells me, like, oh yeah, that's something I'd like to work on, or that's not something I like to work on. And then I tell the teen directly, I say, like, okay, well, I will let your parent know that, like, if that's something we're not working on here, I can maybe talk to the parent maybe on their own and help them, through some of these situations. So I kind of like give the parents, like, because I want to give them something, like, if we're not working on it in here, then I might tell the parents, like, okay, like, do you want to meet to discuss ways to help support you in those moments when you're, so whatever the goal is that they are wanting, because like the parents' behavior and reaction can actually impact, like, the interactions could actually, yeah. So that's how I usually take it anyway, and I hope that helps a little bit. But I like being transparent because I want to be clear on what we're working on, like, and what we're not working on. And I want to have parents to have certain expectations that, okay, they're doing that in therapy, even though we're not. So maybe they could find a different place to do it, or like, or like, yeah, so that kind of thing. But I always say, I think it's like really, really like, okay, well, therapy is a space for them, and like, they need to be part of the process, otherwise they, that's not going to be help, that kind of thing, that's not going to be helpful for them. And I want to make sure they continue to trust me, and we have that relationship built up. And so yeah, some of those things I think helpful. But it is so challenging. Okay, so I have a couple of cases. So I'd like to take a little bit to talk about some of these cases and what people think. Now, there's no, like, and again, there are some books on, like, how to work with some of these things, but some of it is also us being a little creative as well in what we help and provide. And I also have like specific techniques lists as well. So this is so I have an adult example and a child example. So we'll see how much time we have. I'll just kind of spend a couple of minutes on each. So this one is an adult with learning disability, and two children are diagnosed with autism, with actually a total of 3 children. And the presenting problem is actually very family dynamics related. So like, instead of, it gets more like frustration with children and husband with ADHD, sensory concerns, when like trouble when the child hugs the parent, and like not wanting the child to like hug them, like, and difficulty comforting, like that kind of thing, when the child's having a meltdown, misunderstanding, like this communication, like overwhelm, constant, of course, with 2 children with ASD, anxiety, let's say difficulty setting boundaries with other family members too, of like maybe getting too overly mad and upset, and like, withdrawing, or maybe not being able to know how to navigate some of these difficult situations. Just so these are some examples. As you can see, like, they're more like about a lot of the different brain patterns that we've discussed. And so I would want to just bring it up to the group of like ideas for, like, so whether you're doing parent coaching or individual therapy, so like this could be a case for parent coaching, but this could also be a case for individual therapy. So I thought that might be one. So what people might think, how they might approach some of these concerns. And then I'll discuss a little bit of what I would.
You guys can also use the chat feature for this one, please.
Yeah.
So please go ahead, and you don't have to raise your hand, but
Full participation would be great. And if anyone has a question for Dr. Mina, of course.
Yeah,
Yes, Joey.
yeah. Joey?
I did something similar, not with a neurodivergent case, but I think it's really helpful to like have like, I don't know if I have like a little thing here, like get something like this, and like when you need space, like you could just hold it up, like something more
Yeah.
nonverbal where it
Uh-huh.
doesn't have to engage in that like awkward discussion of, which I know a lot of the time like neurodivergent kids don't love having to like explicitly communicate that kind of a thing, but something you can hold up so that everybody knows this is the unspoken rule. You give me my space, kind of a thing.
Mm-hmm. Yes, totally. Like boundary setting, like this is what I need, but in a way that's like developmentally appropriate for the kids too.
Yeah.
Michelle?
I was going to say too, helping the mom figure out what are her own boundaries. So before she tries to set boundaries with the children, like what is her limit and what does she need to do? And because I think sometimes parents feel like too, they have to be everything to both children and the spouse. And I think figuring out some of our own boundaries. And then I love what Joey just did with was it a duck or whatever? Like it was so cute. And just sort of, talking about too, some of this comes with just having children,
Mm-hmm.
Normalizing that sometimes you can have two children without ASD or any neurodiversity, and it can be very different parenting them, and, kind of help her with strategies to identify their needs and work with them.
Yeah, totally. Thank you so much. Yes, Gabriella?
Yeah, I think also kind of more of a positive one, because like mom might be feeling kind of defeated, kind of like what are
Yes.
ways that you do show love in your house, right? There's a lot of different love languages, and physical touch might not be one of your families, but how can we still convey that you love each other, because that's obvious, you're a family. So kind of exploring the side of how what is the exception to this feeling of overwhelm.
Yes, exactly. I like all of these. These are so great. I want to mention just a little bit. Let's see what the next slide says. Okay, so one of the things that I found a couple of helpful, this is just a long list, but let me go through a little bit. Like core values are very helpful for me when I'm working with this parent. So like what do they really want to teach the kids, and what can they connect with their values? What kind of really changed for me when working with this parent, knowing that there may be like this autism diagnosis going on, is like really being more direct and with my communicate. Like I changed up my communication style, and that made so much difference, which was so interesting because like it provided more clarity, because the parent doesn't do well with like anything indirect, or they're like, no, you just have to tell me what to do, and then like, but they just want to know, like, okay, and I say, okay, yeah, this is because this is happening, you got to do this, and I'm just more direct, and then they're like, okay, I can do that. I can try that. And it really made such a big difference. That's why I thought it was really interesting, because it's like just that communication style. My communication style is not very direct, so I have to actually think so much in order to like do it. And so I think that was such an interesting shift, and that really helped a lot. And then of course the validation piece is very important. I like everyone talking about setting boundaries, and also using things like knowing I can accommodate myself. The other one that I thought was interesting was like with the hugs. It was like, I forget which one it was, but one hug was like overstimulating, but another way of hugging was like fine, or something, like not liking like this, but liking like back from the back or something like that. And so just like knowing these things are really helpful to kind of help some of these. And then let's see. So I'm gonna go to sometimes you can practice like, okay, let's practice like doing this in the session or in the moment. I think another thing I actually did was like some acceptance work, like, because like there's a lot with control, like I need to control everything in my environment kind of thing, like, I need to control the way my husband is and make sure that he changes and he changes his behavior. And I told her, like, I don't think that that's possible. I mean, possible for you to be able to control that kind of thing. Like, I try to be more direct about that. And then she realized that, like, okay, I have to change my own behavior. I can't just focus on the other person. And that really made the difference too. Let's see what else people have. Yeah, I think I was trying to focus on like then to understand the I think it's even focused about like acceptance versus understand. Like, okay, like maybe you won't understand, but how can we accept that this is what's happening, kind of thing. Like, because I think I was so focused on like, okay, how do you understand? Like, I'm giving psycho ed constantly, and it wasn't like sinking in, and I was like, okay, maybe we'll just focus on like accepting the situation as it is, kind of thing. So that was interesting too. Okay, so just a couple notes on this. There's a lot here, so I know you don't have to like necessarily read all of it, but I just wanted to provide some example of like, okay, if you have a symptom like school refusal for a teen, and both like, and like, if usually it's going to be both. So like with autism, I had to kind of put down like, this is what I can see. With anxiety, I put down, this is what I can see. So like, for example, with anxiety, we're seeing more about like, what is the core fear? What is the anxiety avoidance cycle? We're going to break it down into steps, do the exposures, reward plan, all of that. But with autism, we're going to have to add these things. So like, what are your values and goals? Strengths and difficulties, validating that the actually valid, like, there might be things going on that like are really, really overstimulating in the environment. There might be things happening that are very confusing. We want to know what is actually the triggers related to the school refusal. And then we want to figure out if we can make any accommodations to help them actually get to the place to get to the school. So like, if there needs to be more of like an IEP or some change going on. So I have a parent, I'm working with a parent that they do such a good job advocating for their kid that even when I thought it was amazing in the sense of like, okay, like I noticed that my kid is sitting by this person that dysregulates them, can we change that? Like, even up to that. And I was like, that's so wonderful, because like being able to just be like, okay, I'm noticing something in the environment that will not work for this kid with autism. And so then how do I advocate for that? And us helping the parents, like, you can do that, you can advocate for that. And then of course, let's see, helping how to communicate. So again, like, we need to add more to just the regular anxiety protocol. So I just wanted to mention that. And then let's see, so similar but different. So like, providing structure and choice, I kind of do a lot of compromising, incorporating special interest, that lots of validation. Like for example, like the kid that I see like always says, but I don't get that, because I'm like, yeah, I get why you don't get that, or I get why, whatever. Like, I'm just constantly like kind of like understanding like their perspective, valuing their perspective. I think it is important to set some boundaries and teach communication, but I think that part it depends on where they're at, in the therapy room. If you're working on the rapport building, you focus on that. If you're working on like, just saying the word, like if I say like, okay, let's work on a coping skill, they'll be like, no, I don't want to do that kind of thing. So it's more along the lines of, what are they kind of giving them some autonomy and collaboration, giving them some choices. I had to do a lot of that with transitions, like timers, warnings, choices, because like they really struggle with like transitions within the therapy context, actually. Like, from when we started playing a game to having to stop playing the game to do something else. If something changed within the therapy structure, it would be like a meltdown. And so those are just some examples of how that some of these behaviors can kind of interfere with the therapy process as well. Okay, so I just wanted to see if anyone had any questions in the last couple of minutes, or any thoughts. And so, yes.
I don't have a question, but I wanted to clarify. This was brought up to me by a few of the therapists. Sometimes there's generic accommodations like preferential seating, extra time on tests, but I think until you get into the heart of it, preferential seating doesn't necessarily mean to sit in the front of the room by the teacher's desk, because if the kid is distracted, that's going to be bad. Now, I had one case that I was working with, and by having the Zoom call with the parent, found out that preferential seating was on the accommodation, but it wasn't working. Well, for this particular student, she was placed at the back of the room thinking she wouldn't be as distracted because the people were moving in the front. She was overwhelmed by seeing so many people in her class. So, and she's in a block schedule, so she has a different teacher every, every session. So we put in the accommodation. She needed to be in the front row, off to the side by the door. So she kind of had almost like a horse's blinder on the one side where she could only see the wall, and then the other side wasn't so overwhelming for her. So just to let you know, there are or even a time test. Some kids can take it with help in the regular classroom. They don't have to be isolated, but they need someone sitting by them, because if it's a computer-based test, they're going to be clicking all the time, where they just need someone sitting next to them saying, let's read the question first, put your hands under your butt and just wait a few seconds. So there's different types of accommodations, and that's kind of where I come in to help if it's anything to do with IEPs or 504 plans. So please reach out if you have any questions on that to me.
Yeah, that's wonderful. I love that, because that's what we just talked about, is changing that environmental piece at the school. Giving those accommodations is going to be really, really important for these populations. So thank you so much for bringing that. And I like the clarification on what is actually the need here. Like, okay, preferential seating, but what kind? And yeah, so that's really great.
And sometimes you can't get that just by, like the conferences that I have, I can delve a little bit deeper in what's the whole picture, what's they're doing at home as opposed to school. So I'm happy to help out with that.
Yeah, totally. Okay, let me know if there's anything else that you want me to get back to you on. Thank you for thank you for all your suggestions in the chat. I'm looking through it now. I'm just gonna save that, and then yeah, sounds good.
Can you remind people when your office hours?
Oh yeah. So it's gonna be Wednesdays at 2.
That's on the calendar. And for those who don't know, Judy, who just did speak, she's our education consultant. So y'all did kind of a quick training on Judy, but that's who she is. So Judy Stevens, reaching out to her. If you can't remember what her name was and you're curious about education consulting, just reach out to KM, Alexis, and I, and we can connect you as well for that service line. And Dr. Mina, thank you so much. You always have just a wealth of information. If anyone needs additional case consultation, of course, just one-on-one specifically for what you guys need. So much love coming out here for you. But, reach out to Dr. Mina, of course. And I think that you guys are doing case consultation stuff today. So we do want to make sure in youth and parents that you guys have that time for more one-on-one, whereas Learning Lab is a little bit more like, learning and how to take this stuff and doing some more hands-on things. And then really using, other opportunities for case consultation as well and drop-in office hours. So thank you, everybody, for bringing everything that you do to the Clinical Training Institute. Thank you, Dr. Mina, and everyone just have a wonderful day.